Hey, it's Matt Roush,
And Mike Brennan, you caught us there.
and we're back with another segment of the M Squared TechCast. And we have with us our friendly epidemiology expert, infectious disease expert, Fred Brown. Fred, you wanted to talk to us today about an app that you're working on that I think has real potential here. So, Mike, unless you have another question, why don't we just let Fred start talking about this app?
Yeah, I looked at your slides real briefly before we came on air, but I got the general gist of what you were up to, and I know you pretty much in the very basic stages of it. But the app essentially what it would do was it would tell you whether you can engage in daily activities. And for instance, in the slides that I looked at, if somebody had diabetes, you check that off on your health questionnaire. And then it would say, maybe it's not such a good idea to be in this area because the COVID contagion is very high. But it's your creation. Why don't you kind of explain it and walk us through this?
Sounds like a plan. I'd be happy to. Let me share my screen with you, and we'll take a quick look at the app. Basically, what's happened is that I get calls from people, and they say, I've got my grandmother, or I've got this issue, and I really want to do something. I want to move her from her nursing home, or I want to go out and do certain things. And as I was working with different governors, I realized that basically a lot of the governors are going to allow the citizens to make their own choices about these things, because we have quite a different perception of our risk levels, and we also have quite different levels of risk tolerance as individuals. And so I wanted to create something that would allow people to be flexible in the way they applied the app, both for themselves and for people in their lives. So with that, why don't I take a quick look and basically point out this is really happening on a global basis. So the app is intended to be free, and it's intended to be global. But I'll focus on the United States, and one of the people who I wanted to focus on is this kind of a new tool set to help with pandemic management. And what's nice about this tool set is it's going to allow us to integrate both what the governors are doing, what individuals are doing, and what businesses are doing with a common set of data. So we can kind of tell and see how we're influencing with our own behavior the overall environment. So this is the support tool. Basically, there are three big factors that I think everyone has to think about. The first one is how risky is the environment? And basically that's determined by the virus itself. And what we're doing to encourage the virus to continue to reproduce or to get it down. And so how risky is the environment? I look at viral activity, the healthcare capacity. If you do get sick, is the hospital available? Testing levels, because we want to make sure that the models are being run appropriately with the right levels of data, and crowd levels, because crowds really are what generate your position and amount of time you spend in a crowd really determine, and if those people in the crowd are ill and not knowing it, they're asymptomatic frequently, they could pass on the disease to you. So those four areas for riskiness of the environment. Then you have to kind of say, how at risk am I? And that's based on age. We know that basically once you get over 70, even 60, sadly, your risk of fatality from this disease is significantly higher. Sex does make a difference. Estrogen levels seem to reduce the risk of fatality and intubation requirements. Late stage COVID, there's no preference for the virus to go after male or female, but once you get the disease, if you're male, you don't have as good an outcome as females do. Your medical condition, of course, you talked about diabetes, that's a big one. Being overweight, especially BMI of over 40 can affect you. Smoking, of course, affects you. It's a respiratory disease. Asthma can affect you. Cancers can affect you because you're immunosuppressed frequently with the drugs you're on. And of course, heart disease is the big one. So if you're hypertensive, which unfortunately about 60% of us are once we get over 60 years old, that's a big one. And heart disease itself. Immunity level also. Eventually, we're going to find out that we're immune or not immune because we've actually been infected before. And then the last area is how risky is the activity? And that is, can I get exposed to the disease while I'm doing this activity? How long am I going to be doing this activity? How mobile am I during this activity level? And are there alternatives to the activity? So those kind of three big things are what each of us, I think, in the era of COVID, if it is as dangerous and deadly as we think it is right now, we'll kind of have to use a weather forecast. And every day we'll get up in the morning, like our friend Blake does. And oh, here's Blake, and he's 61. He lives in San Francisco. He's with one of our partners, Google, and he's been at home since the 15th. His mom lives in a nursing home in Arizona, so you can start to get some of the use cases here. I mean, you want to check up on his mom. You may want to take a look. You might want to have his wife do some things for him, and his adult son also. And Blake is running out of meds, unsurprisingly, and he wants to know, is it safe for him to pick them up at the pharmacy? So the first thing he does is the night before Governor Newsom, this is California, so it's Governor Newsom, but Governor Whitmore will be the same thing. He does a one-time kind of notation, like you said, Mike, on this. He says, okay, I do have diabetes, and about the rest of it I don't have, so I'll put this into the formula, and tomorrow morning, on the next day, the tool comes up and he hits his little application device on his phone, and he has a weather forecast. And the weather forecast indicates a reproductive rate, which is the R0 we've talked about before. That's the effective reproductive rate of the virus in that state. And we have this now for every state. It's been we've been monitoring this for about, we have over 1 billion data points now. We've been monitoring this for probably 45, 50 days. It's quite predictive of what's going to happen in the future. And so we like this tool, but it's not quite enough. We want to have more data sets. And so we're also using a modeling tool that helps us decide whether we're going up a curve at a peak or coming down a curve in terms of new caseload. Right now, you can see that we're past peak, which is a good thing because that means every day past your peak, you're going down the curve until you hit a low number. 0.86 means we're not quite down to 0.5. That's when you'd expect us to be at the very bottom of the peak. But you can see that decrease still going. So overall, the forecast looks pretty good, and his mom's doing well in Arizona, so that's all good. So then he kind of zips in a little bit closer, takes a look at California more closely, and it's a lower risk environment today. Virus has passed its peak, looking good. The fight for California is winning the fight, and it still is, by the way. California's in pretty good shape with the exception of some parts of Los Angeles. So Blake can now drill down right into California. He's in San Francisco, not Los Angeles, which is a good thing. But actually in San Francisco itself, it's a medium risk today. You can see the active cases of it has increased recently. The new daily cases have increased recently, and the average new cases per day is 52, and that is over target. Right now, Germany, for example, has an average new case per day of 35 throughout the whole country, and Governor Cuomo just said he wants an average number of new cases, I believe, of less than 10. So that's those are getting really strict in terms of how risky or not risky it is. We can vary this based on what the local laws are, so that everyone can tune in pretty easily. So that's the environment. Now he wants to take a look at where he's actually going today. He's in San Francisco, so he takes a look and sees what's going on really with the hospital situation and the testing centers. And the testing centers are slow, and that's bad because if he gets a contact with somebody, he wants to go and get pretty quickly tested to find out whether or not he's gotten infected or not. After about 2 or 3 days, they can tell this if you suddenly got into contact with somebody. So luckily, there are two there with 24-hour turnaround. That's a good thing. The positive test rate is 5.2%. That's way high. That means we're not testing enough. Our testing density is that high. It should be below 3%. Otherwise, we were getting a high positive test rate because we're just not testing enough people as we would expect. And then the hospital bed shortages looking good. Fatality rate well above normal, 1.6%, not bad. So he's in pretty good shape. He says maybe I can venture out today, but there's tools saying, well, like you're a little bit, you're not that in great shape. So if you have to go out, stay in if possible today. Use PPE because it's still going down. Maintain social distancing, and only enter venues using your best safety practices. So now we're starting to get into the activity that he's planning for himself. First, he goes back and he kind of checks. So how risky am I? And Blake is actually at a 2.8. That means he's got a fatality percentage rate of 2.8% with his diabetes and his age. He's 61. Plus he has diabetes. So that's a pretty high susceptibility rate. He's compromised and he's susceptible. And so now with that in mind, if we were young people, we probably, we wouldn't even think twice about it. We go out there because we're basically in a green zone. If we're older, kind of in the 80s, you probably isolate yourself here. You probably wouldn't think about going out at all, pretty much. If you're compromised, that means you're young, but you've got a disease state. You have to kind of talk to your doctor and figure out just how much risk you're at. But all this app actually looks at what we know about fatality rates with susceptibility versus your age. And based on that, it maps where you are. And you can see Blake is up in that upper that upper left-hand corner, which is a dark orange, not great. So with that, he then takes a look at the activity, right? So it's not just walking in the park. He's actually going to go into what could be a crowded downtown area for our pharmacy. And that's not so great. The other problem is that this is the day of Governor Newsom's opening up the entire economy, and so there's probably a lot of pent-up demand. So based on other states who've opened up, like Oklahoma, South Carolina, and others, we pretty much know that although right now, today's Sunday or Monday, that we would see 41% to baseline versus what he was seeing before the pandemic. We look at this versus March 1st. So March 1st levels were 41% less than normal, but because it's the day of the opening, we think that actually he could be as much as only 20% below opening, which is going to be pretty crowded in certain times of day. So if you have to pick up the meds today, then he has to really look at terms of what the pharmacy is doing for him. At the pharmacy, what he's able to do is he's able to stay outside the pharmacy. It's a CVS. He wants to CVS. That's his local guy. And he sees that it's well ventilated. There's hand sanitizer around. He's got his own. He's got no lines, shielded checkout. His masks, and what he notices everyone's going in and out without any being counted. There's no restrictions in that. There's no masks and gloves worn by people who are going in and out. The 6 feet distancing looks like it's not being withheld because the aisles are pretty tight. There's no hand washing. They don't have any signage about the fact that the employees are washing down the surfaces after it's being touched. And there's no thermal screening. So look, he sees these things and he says, well, it's not exactly safe, and it's pretty crowded today at this point in time. So he looks and says, maybe I could go to a different CVS. So he looks and says, here are all the different CVSs in town. And actually in Los Angeles, they have a Yelp type app that actually says, here are the companies that are doing well with social distancing, well with cleaning and keeping things going. And here are the sites and the businesses that aren't doing so well. And so we think that this is going to become pretty popular in the future, and that there'll be apps like this pretty regularly. People saying, hey, I went to this place and it was a mess, or hey, I went to this place and they really did a nice job. And you can then decide, let me go to that one instead of this one. Or maybe he wants to go to they'll advertise, we have a pickup window for your drugs. You don't have to come into the store. Or they have automatic delivery. Well, after he goes through all this, he decides at the end of the day, with his environment, the risk of the environment being 0.86, which is good. It's a green light. But his own risk and the risk of activity at that particular store is probably too bad, because the line at the pharmacy means he's going to have to stay in that store for quite a while. They didn't seem to have very good social distancing in place, and so he decides that he'll have his younger son pick it up for him, and that he'll use this now to think about going to a picnic at the park with his wife tomorrow. And of course, this app also would tell you which parks are open and which parks have a lot of availability and aren't too crowded. So with that, that's the sort of the daily routine I think people will start to use. Should we continue to find that COVID is extremely dangerous for some risk for some people, and that some of these activities are more risky than others, and you want to be able to weigh that risk each time you do it. And especially, you can imagine flying into a new town, and being on the road and needing to have this new information set for you. That's because it's available everywhere. So what do you guys think?
Where do I sign up?
Now, where is this in development, Fred? Is this still kind of a concept, or have you moved forward on development?
Well, luckily, there are a couple of big companies that have decided to try to help us. Google's helping us to some extent, a small extent, or they're considering what they want to do with us. Tableau is definitely helping us with some front-end applications. We've got the whole thing in the Azure clouds. We have the data sets we need for the most part. The challenge is making an app. I'm not an app guy, and so we're trying to find people who really know a lot about app production. You've got to have both the Apple environment and the Android environment supported. We're talking to Apple shortly, and so on. So we've got a ways to go, just because, and of course we're trying to do this for free, and so we're using the best we can from people who are available and like it.
Well, I have some suggestions, but I'll give them to you
Wonderful.
once the show is over. So
I
I
appreciate
don't
it.
want to do any endorsements here, So
Fredbrown.com, just send them in. I'd love them.
all right, sounds great.
Traditional four-year students love Lawrence Technological University's thriving campus life, but LTU has always met non-traditional students' needs too. Lawrence Tech offers over 100 degree and certificate programs that can get adult students started or back on track. And most of our classes are conveniently offered evenings at our beautiful Southfield campus or online, so you can balance your social, family, and work life even while you power up your career. Lawrence Tech, where Blue Devils dare.